The South Shore's Morning News continues. Great to have you here. And once a month, NVNA on WATD, our great friends at NVNA come in studio, and that's a chance for us to check in with the CEO, Renee McInnes. Renee, good morning to you.
Hey, Rob, nice to see you again.
Great
Thanks
to
for
see
having
you.
us.
We have some big news and then also a special guest you brought along with you as well, right?
Absolutely. Yes. So, wanted to let everybody know, and you may have heard or seen information on this, but on December 1st, we will be Croy Health.
Ooh.
So, we're rebranding. NVNA and Hospice. We have grown and expanded, and we are no longer NVNA and Hospice only. We have palliative care. We have the Pat Roach Hospice House, which was opened in 2013. So over the past 17 years, we've changed and grown and expanded our healthcare in the community. And we continue to expand and grow healthcare in the community as a community partner to the South Shore.
You do an amazing job. So this is one of those things where they say this name better reflects what we do today.
100%.
Okay.
And Croy means heart in Gaelic.
I looked it up.
Yes.
I wanted to know
So
what it meant.
very exciting.
Yes.
So we are Care, Trust, Heart. And it will better represent who we are into the future. So we're very excited. We're independent, nonprofit, continue the same leadership, just a new name.
Yeah.
No merging, no new ownership.
Well, because I was going to say,
Right.
you must be fielding a lot of those questions, because usually when anyone has a name change, the other thing is, oh, there must be this mysterious Croy Health company that came in and gobbled them up.
Yes. No, none of that.
It's not the case.
No.
Yeah.
Just a new name, that's all. Same care, same quality.
Same Renee.
Same Renee.
That's great. Well, congratulations on that. I know this has
Thank
been a long
you.
time in the works, and
Yes.
we'll be talking about that, and we'll rebrand
Yes.
the name of the segment here going forward.
Yes.
Let's see, who have you brought along with you? Who's over there
we're
next
very
to us?
excited.
And on YouTube.
Yes, on YouTube. Hi. We're very excited to have our special guest, Dr. Susan Swords, South Shore Health primary care physician. And she's also part of our board of trustees. So very excited to have her. So welcome, Susan.
Thanks so much, Renee. I'm so excited to be here today.
Yes. So really want to talk about today primary care. And, we want to tie it in with the government shutdown because we all need to speak about what's really happening here. So, Susan, just to start, what is primary care and why is it so important?
Well, it's funny that you asked that because I actually just saw one of my primary care patients who is actually a member of the radio station. So it's so primary care, in my opinion, is the first stop in a patient's healthcare journey. So it's the person that really takes care of you when you're sick, but also helps to keep you healthy when you're feeling healthy. So we order cancer screenings. We talk to you about your habits, for example, what you eat, your exercise, your sleep, your relationships, your kids, kind of like just trying to figure out how to help you live your best, healthiest life and really get to know you so that if something happens, if you hurt yourself or you get sick, you have someone to go to that knows you, understands your health history, and can help kind of order the right tests to figure out what might be going on with you, send you to a specialist that you think might be a good fit for you in an ideal world. Now, unfortunately, we don't live in an ideal world. So right now in our healthcare system, a lot of people don't have primary care doctors. A lot of people don't have access to their primary care doctors for various reasons, and we can talk more about that. But that's essentially what primary care is. It's the person or the team who helps to keep you healthy.
Oh,
and tying that in, Dr. Swords, with what's really happening in the government shutdown. But not only that, we were just discussing, healthcare has been upside down for the past 20 years or so, probably even more, in terms of the payer and the provider and how that all works. And it's just not working anymore. And how do we pay for this healthcare? Our healthcare costs have gone up and the access has gone down. And really, why do you see that happening?
I'm so glad that you asked that. I actually have a couple statistics that I brought in today to talk about. So right now, as many of the listeners I'm sure know and have heard, the government has been shut down for over a month, now the longest shutdown in my lifetime that I can remember. And the focus of that shutdown was really over healthcare subsidies. So basically, the Democrats have held out thinking that our government should subsidize healthcare, subsidize subsidies for private insurance plans that came on the market under Obamacare. Unfortunately, healthcare prices have climbed, have gone up. So those subsidies are costing the government a fortune. And they're pretty recent. So those subsidies really have only existed since 2021, since COVID, and then were extended under the Inflation Reduction Act. So basically, we have this untenable situation where healthcare is so expensive. The Democrats rightly want to protect the 24 million people who rely on those plans to access their health care.
If they need it, they want it. But then on the other side, these were never meant to be forever.
Right, exactly. They were never meant to be forever. And the Republicans, rightly are pointing out that healthcare is so expensive. It's a huge part of what the government spends on. And it's a huge part of what we as individuals spend as well.
So we either keep throwing more and more money at it, or maybe try to address what can we do to make it. We obviously, I think everybody would love to have healthcare be affordable for people. But it needs to be, I guess, responsible in terms of who pays for everything and how the cost gets shifted around.
Yeah, exactly.
Yeah, and I think too, Dr. Swords and I were talking about the fact that the lowest cost providers are your primary care physicians and home health services, right? And palliative care and hospice, okay? And so that is a very, very, very small percentage of the overall healthcare budget. It's more procedures and hospitals and drug costs. And so how can we prevent people from needing more costly procedures and more healthcare and more drugs? Well, we can with good primary care. We can with home health.
Exactly.
Keeping people home and out of the hospital. So there are ways I think that we have to look at. And this is above my pay grade, but there are ways to reduce costs.
You make a great point, because Dr. and Renee, you must know what things cost hospitals or facilities the most. What procedures, what areres of sicknesses and illnesses.
Oh,
so
absolutely.
what can we do to attack the most costly areas?
I'll give you a perfect example of something that home health providers do every single day in a way that I think can help prevent really expensive healthcare. So one thing that Renee's staff at Corey Health, they're in our patients' homes every single day. They're talking to them, for example, about fall reduction. They go around their house and they'll say, hey, maybe you can pick up this rug that you could easily trip on. One of the things that costs our healthcare system a fortune is falls in the elderly.
Okay.
So people at home, they trip, they fall, they break a hip, they break a vertebrae in their spine, even a wrist. They
That's
end up
expensive.
in the ER. They end up with surgery. Sometimes when they're in bed after breaking a hip, they get pneumonia. When they get pneumonia, they end up in the ICU. ICU stays are incredibly expensive. But think about all of those falls that we could prevent if we had really good access for our elderly patients at home to have people helping out with just trying to keep them healthy in their home, help reduce those falls. So that's just, I think, one example of a way that we can reduce costs, but we need money for that. So, Renee had mentioned earlier that we spend such a small percentage of our overall healthcare costs, trillions of dollars in this country on primary care and home health. I actually looked up statistics on that. It's less than 5% of healthcare dollars spent on primary care and less than 3% on home health.
Oh, wow.
Yeah.
Oh, I didn't realize. Okay.
It's a tiny, tiny fraction. The vast majority goes to hospital care. It goes to procedures. And what we're also kind of not really talking about is the huge cut that private health insurance companies take. The private health insurance companies in this country are really set up to make money. So they're not there for our greater good. They're there to make money. United Healthcare makes billions of dollars. And how do they do that? Well, we pay money to United Health to have their insurance. They take a big part of those fees for themselves, and then they try to pay out as little as possible on actual healthcare. So in other countries that don't have such a reliance on private insurance, there's more money to go around for the actual care, the actual healthcare. And other countries spend almost 3 times as much as we do on primary care. Primary care and home health are cheap. I mean, we don't do surgeries, we don't do procedures. We're just there to help keep people healthy, help keep them out of the hospital.
So more primary care, because that's what you were saying at the very
Right.
beginning before we went on, would help
more
at least to
prevention.
cut costs. Yeah.
Yes, more prevention.
More prevention.
And I think the other thing that we were talking about,
Yeah.
and cut us off, Rob, if we're talking
Oh
too
yeah,
much.
I know. We've got
But
about
we
one
could
more
talk
minute.
all day on
I
this.
know,
But
I know.
the other thing we were discussing is, it's nice to see, all of the primary care physicians rally around, that we're not going to take this Medicare Advantage plan because we lose, for us, we lose 52% of our direct costs to care for those patients. Of course, Dr. Swords and myself, we want to serve everyone on the South Shore because we care about the community. So we take insurances that we're losing a lot of money on just to care for our patients, but it's not sustainable future state. So I think they needed to stand up and say, it's not working.
Yeah, not sustainable. Okay,
Right.
well, a good conversation to have. Unfortunately, we're going to have to keep talking about it, but it was good to have both of you on this morning. Renee McInnes, of course, NVNA, now Croy Health.
Yes.
And, of course, also with us this morning from South Shore Health, Dr. Susan Swords.
Thanks so much for having me, Rob. And
Thank you
Thanks,
so
Rob.
much.
Okay.
Thank you.
Good
We'll
to
talk
see
to you
you.
next month.
Yes.
All right.